Hi, my name is Dr. Anthony Kleinsmith, PhD, and today I have with me John Krug. And John, you have a pretty amazing story because of everything that you've gone through and your use of Immune Tree Colostrum 6 for benefits, correct?
Correct.
So anybody that is suffering from, say, Crohn's or diverticulitis or congestive heart failure or open wounds, as you said it earlier,
Right.
would be beneficial in getting some of the colostrum into their bodies.
Exactly.
Okay.
Exactly.
Let me give you a little bit of history, folks. John's a diabetic. He has been registered as a congestive heart patient, so he has congestive heart failure. Because of the poor circulation and blood flow, he contracted Crohn's and diverticulitis. He had holes in the intestinal wall, correct?
Right.
Okay.
They were diseased, and they were just dwindling down to nothing.
And because of all of this, you went into the hospital.
Right.
They ended up removing your colon,
Right.
putting you on a colostomy bag,
Right.
and you had how much of a chance of living through all of
They
this?
give me, at the time in the hospital, they give me a 3% chance of living.
Now, they did some other things while you were in the hospital. They opened you up from stern to stem, as they say,
Exactly, yeah.
but they left that open.
Right. Because 3% chance of living, why take the time to sew me up? They figured me dead.
Okay.
And when I came out of it, they were amazed.
So they left it open, and then you contracted bed sores, because you were in the hospital for over a year.
Oh, yeah. I laid on my back. I couldn't get on my stomach. I could barely get on my side. I was doped up to the point I didn't know who was there, where I was, or anything.
Okay.
And that bed sore got bigger and bigger, and it got to be the size of a grapefruit.
And tell me, can you describe it a little bit? I know it's a little kind of iffy, but
The bed sore?
yeah.
The bed sore was just an open wound that you get when you lay on your back in bed and you don't get to move, you don't get the circulation of the blood, nothing goes to working like it should do, and you get a sore, and it starts to sore, and it gets bigger and bigger.
How
And
bad was it?
It got clear down past, the bone was showing in my buttocks.
Okay.
The bone was showing bad, and I was going to have probably some kind of a surgery or something to cut the muscle, bring it over, and do this. But the doctor that I had at the time said, let's go with this other. We went with the colostrum and started packing and doing that. And little by little, the wound started closing and closing. And it wasn't hardly any time. I can't remember the time. It was a short time. It closed right up.
Now, they gave you, obviously they've done multiple surgeries like this for forever.
Right.
But they told you something that was pretty amazing as to the quickness.
It was 50%, I can call it 25, but I healed basically 50% faster than they had ever seen anybody heal before. And I figure it was due to the colostrum, because I'd heard so much about it, and I wanted to try it, and what it had done on other people, what did I have to lose? So I tried it. What did I have to gain? I'm here today talking to you.
Well, now you went back in. Okay, you're on a colostomy bag. You go back in for a hernia surgery, and you
2 years later, I go back in to have the hernia taken care of, which they didn't take care of at the time. I went back in, and the doctor said, well, we're at it. Let's try to reverse this, get the bag off of you. I know I can do it, and we took the operation and did it. At that time, there was a 4% chance of a hole being in the bottom bar of my stomach.
Okay.
And when they knew there was a hole there, when I went to eat something, I got deadly sick. I had to go right back in the hospital. Then I went on the bag, off any food, any water, for 30 days. I had nothing.
What were you doing, though, in that 30 days?
30 days, I was laid on my back in bed, and they were giving me all kinds of everything, checking my body with this, checking my body with that, giving me everything the hospital had to try to get find out what was going on, what was wrong with the wounds, why.
So they reattach, but you were sneaking something into the hospital.
I got my girlfriend to sneak the colostrum, and I was getting it in the capsules, because the thing I'm holding here is too big.
Right.
I didn't want him to see it, so I kept it in the drawer, and I'd empty the capsules into the capsule
little
containers they give me. I'd empty it, and when nobody was looking, I'd take 12 capsules in the morning and 12 capsules in the afternoon. But I couldn't have any water. I'd have to put it on my tongue, put it in my mouth, and just absorb it with what your spit.
Kind of like a sublingual absorption.
Right, absorption. Okay. And then I figured it was a matter of 2 weeks, and that sore, the hole in my wound had healed. And I went to see him, and all my tubes that were in my stomach, everything showed clean.
So they unconnected everything,
He said, no, you go ahead and eat. So I went ahead and started eating, and I held everything down. Everything was good. And he says, it's time to take the tubes off. And I took those off, or I didn't take them off. They professionally took them off, and everything went fine.
So how are you doing today?
Today I'm doing terrific. And I've got to go back for another checkup. And when I go back, every time they tell me, you've cheated death again. How many lives? How many lives have you got?
Well, I know that your bowel and your colon, you're 100% there.
Working functional fine.
And they also told you something about your heart.
My heart, they found out that when I went to my heart doctor and he checked my heart out, it has increased 25% to the good. It's doing better function now than it did then. And if I exercise and do what I'm supposed to do, I'm not going to get a perfect heart, but it's just going to give me a few more years to live.
So let me ask you a question. For all those folks out there who have Crohn's or congestive heart failure or diverticulitis or even diabetes, what would you tell them about this product?
The first chance you get, you're going to have trouble getting it, using it because of your doctor, but if you can some way get them to convinced to take it or take it on your own some way, take it like I had to do, and I guarantee you it'll help you.
And folks, here's what's fascinating about your doctors. They don't like nutritional supplements for the most part because there's not a lot of research. Well, we have a health practitioner's guide. 11 pages on this guide is nothing more than references that they would need to make an informed decision. So would you say Colostrum 6 or from Immune Tree?
I would say definitely go with the Immune Tree Colostrum because it's 100%, and I've used it and I've proved it.
Hi, I'm Dr. Anthony Klein. I've helped a lot of folks introducing them to our colostrum and the benefits that they get for different things that they've experienced. Like myself, I've experienced wounds from the surgeries that I've had on my knee, and it's done wonderful things for me. Today, I'm going to introduce Mike here, and I'm going to let him tell his story. Mike?
My name is Mike Street. I just had a reconstructive surgery on the shoulder here, and after the doctors were done, I actually had an allergic reaction to the tape, which left me some blisters on my arm here, and I heard that this was supposed to be really good for scarring and healing, so I was putting Neosporin on this anyways, and I just got the wild idea to break open a capsule and mix it with Neosporin, and before they'd just pus back up and just keep pussing and scab over and pus, and after I put this on it, the next day they didn't even blister over anymore.
So in one day they were gone?
Yes, by the next morning.
What about, now I know that you had a lot of swelling, you had a lot of edema, water retention.
There was enough swelling, it looked like a softball was in my shoulder. I actually had to go back into the doctor a couple weeks after, but I went in a week after surgery and he saw it and he was astonished by how swollen up it was. But I started taking this, and the next visit he was pretty amazed at how far it had gone down.
So he was once again astonished that something's changed and accelerated the healing process.
Yep.
Okay. Well, that's another testimonial for our Immune Tree Colostrum. Let's hold that up, and this, folks, is what will help put your body into a balanced state and allow it to heal. So, Dr. K and Mike signing off saying thank you.
Before and after shot of this. Now this is a complete shoulder reconstruction. This is a major surgery, not an easy surgery to recover from. In fact, there are baseball players that have this injury that never recover from it. They can never go back to playing. You know, you get pitchers throwing their shoulders out. Same kind of surgery. and I don't see many of them coming back and pushing up 275 pounds 7 times. Not in 6 months. So, Mike's looking good, looking ripped. You can see, yeah, give us a little flex there.
A whole lot of movement in it still, but it's strong.
Yeah, it is looking, I mean, for 6 months after, that's unreal. I think that any medical doctor is going to look at you and say, I don't know why you're recovering so fast.
They took me to the hospital. They said that I was suffering from congestive heart failure. They told me that I was not going to be working and exercising and lifting weights and doing the things that I dearly love to do. My opinion, colostrum, as I told you, is the key to me arriving back to a state of health that I run into a lot of people my age that are not doing it.
I was born with a crooked spine. A crooked spine throws you off balance. That throws everything else off balance. I did find, fortunately, Anthony Kleinsmith and his true colostrum. It is the most regenerative, life-sustaining product on the face of this earth, and I'll take it the rest of my life.
I have had rheumatoid arthritis for 5 years now. 3 years ago, I was fighting the terrible, very, very uncomfortable aspect of it, which means your colon is extremely inflamed. You're having chronic diarrhea on a daily basis. 2 weeks, my symptoms improved significantly. Within the 2 weeks, I would say my colon almost normalized. Within 2 months, it completely normalized. But at 2 weeks, I was so impressed because after taking colostrum for nearly 8 months of other brands.
I've got some old sports injuries. I've got a bad knee that I injured playing football. I've had back surgery. I have a scar to prove it. Flexibility is there. Energy is there. Strength is there. I'm able to do what I want to do now. And I am an older gentleman.
Well, I've had really severe allergies since I was a teenager, and I've taken all kinds of medicines. Once spring starts, I get the watery eyes, the sneezing, the runny nose. But then after I started taking colostrum, about 3 weeks, the watery eyes and itching went away, and the sneezing almost completely stopped. And ever since then, I've never taken any store-bought antihistamine, never went to an allergy.
I was born growth hormone deficient, and thought, well, if it's got the growth factors, well, I know that it costs a lot less than the $40 a day hormone replacement treatments I'd been on from my endocrinologist. And so I thought, I'll give that a try. Sure enough, within a very short time, I was experiencing better health, muscle development, weight loss, and just a whole plethora of benefits in my life.